When Earl Williams was diagnosed with diabetes, he thought life as he knew it was over.
The first thing I did was panic. Back in the day, they used to call it that sugar. And when you had that sugar, it was like a death sentence.
On the streets of Chicago's South Side, you see men and women on the side of the road asking for money, often blind or with missing limbs, a telltale sign of diabetes. Williams, now 62, lost his health insurance coverage with his job. The future looked bleak. Then came the Affordable Care Act, Obamacare. The act expanded the Medicaid health care program for the poor to include more people, including him.
Obamacare affected me. It's really like a lifesaver between life and death.
Suddenly, he had a regular doctor and a team of specialists and access to a nutrition class. He lost 25 kilograms and his blood sugar levels went from alarming to nearly normal. It's not just the patient experience that's affected by Obamacare. This whole suite of offices at Woodlawn Health Center, a nutritionist, a case manager, a behavioral health specialist, and a referral expert are all funded through the Affordable Care Act. Now, Republicans in Congress have proposed repealing and replacing Obamacare. The new proposed law would also slash subsidies for the poor and working class patients like Williams. That worries his doctor.
It allowed him to have access to preventive services, access to primary care services, access to specialty services, along with medications. Anything that prevents persons from coming into the door is a problem, and it could basically result in bodies on the street.
Starting in 3 years, the proposed law would reduce the Medicaid funds Williams uses to get his care. That would leave him with less coverage, or, if his state of Illinois drops the expanded Medicaid coverage entirely, with none. Without it, he says, he could not afford to pay the more than $500 a month it costs for the 7 pills he takes.
That's a critical point in my life that I ain't got to worry about. Without this Obamacare, you put my life, my community life, and my family life at jeopardy.
And we may have to look at a medication change.
If he loses coverage he can afford, Williams says, he'll have to seek care in the emergency room. Washington can pay for care now, he says, or pay more later. John Hendren, Al Jazeera, Chicago.
Only the white man can profit from pain. That was the thought that was put forward during a comedy special on HBO by Chris Rock many years ago. And it was an interesting examination of crime and how we examine crime in the capitalist state. The idea that we still have people screaming about Trump voters getting punched, while the Trump administration is orchestrating a mass murder through omission, is a testament to how cruel we've become as a nation and how divorced from truth we've become for a very long time. The idea of only the white man can profit from pain, the context of Chris Rock's comments were basically that a gun dealer in an inner city neighborhood will get more time in prison than the gun manufacturer who actually made the gun and can legally sell weapons of tools of death on a massive international scale without any reproach. And if we follow that reasoning, you can compare it to anything. Big Pharma as opposed to your local neighborhood drug dealer, the amount of time and punishment they'll get. The white man can profit from pain. The white man can monetize death. Powerful. Unfortunately, because of the history of apartheid in the United States of America, the white man is an adequate, if profoundly broad, casting of who benefits from this institutional corruption. It also has been a linchpin of the Republican platform that their voters will be less engaged with their own self-interest if the austerity and fallout of inhumane policy choices like this healthcare holocaust that's being initiated with the Trump-Ryan Obamacare repeal, where they are stripping basic necessities from healthcare coverage. It has been a consensus in the conservative movement that it's okay to sacrifice poor people as long as they're ethnic or racial minorities. So, sure, some working class and poor white people will get caught up in the thresher of this Obamacare repeal, but it's worth it for the marginalized people who are going to lose their care, because, of course, in a post-apartheid state, the concentrations of poor people of color are going to be a lot higher, because of the prohibitions against non-whites owning property, the prohibitions against accumulated wealth, all the many decades and centuries of unpaid labor. So what's fascinating to me is that we live in a media conversation where, some old guy in a Trump hat gets pepper sprayed at a rally, and the internet, a certain component of the conservative movement and their sympathizers and apologists are crying that an Antifa maced a Trump supporter in the face, and meanwhile, that Trump supporter is basically behind a politician and a political party gaining power and engaging in mass murder through omission. When you take away a cancer patient's medical coverage, when you take away a diabetes patient's insulin in the name of maximizing profit, when you turn over the general welfare of the American people to private tyrants. And I was already quite critical of Obamacare when that came into being, because it was not single payer health care. There still was a lot of there still were a lot of blind spots in terms of coverage. There were a lot of middle class people that really got fucked in those income tiers, the silver, gold programs, and sort of the middle income people really got fucked on Obamacare in terms of having to fulfill the mandate and not qualifying for enough subsidies. And part of the Trump-Ryan healthcare plan is going to undo the Medicaid expansion, which again, if you take away someone's health care coverage, you are sentencing them to death. It is the same as taking them to a concentration camp and denying them medical care. You killed them. And I'm tired of living in a country where capitalism can engage in mass murder for profit as long as they don't pull the trigger themselves. So they can create a food desert where you can only buy garbage food because it's not profitable for a supermarket to be in your neighborhood. And when the diabetes kills you, oh well, that's capitalism, kids. Cost of doing business. You have to break a few eggs. At what point do we acknowledge genocides that don't involve explicitly putting people in ovens. Because the Republican Party and the conservative movement, the capitalists, even in the Democratic Party, can sentence people to death by poverty. And it will go unreported in the American press. It will go unrecognized by the mainstream of American thought. Because it does not fit. It does not pass this litmus test of explicit. We can't call the alt-right Nazis because they don't call themselves Nazis and they're not wearing SS uniforms. It's not explicit. And if you call out what's implicit in what's going on, meaning the actuality of what these political policies do to people, you get condemned as being an alarmist, being hysterical, paranoid. But this is a cleansing. This is class warfare. This is a mass execution of poor people. This austerity program is an aggressive act by the Republican Party and the Trump administration. I mean, even housing. I was reading today in my local newspaper that the part of the Trump austerity program was to cut federal funding for housing in my city. Federal housing, government housing. If you take away food, health care, and shelter from a person, they will die. And the fact is, you killed them. You killed them to punish them for being poor. And even worse, in America, you can be executed because it keeps the books in the black.